So I gave a presentation today about Selinexor, which is a first-in-class oral selective inhibitor of nuclear export. So the target's a protein called XPO1. The drug was recently granted an accelerated approval by the FDA for the treatment of multiple myeloma, but in lymphoma the development is still ongoing and early. So we were involved in a phase 1 study that ultimately identified the recommended phase 2 dose of the drug, which ends up being 60 milligrams twice a week. And the phase 1 study was notable because it showed responses in some fairly heavily pretreated patients with large cell lymphoma. The safety of the drug is there. From a side effect standpoint, the main things to watch for hematologic toxicity, which can be managed with growth factors and dose reduction. And the main toxicities that the patients will experience will be more mild nausea or anorexia that can generally be pretty well managed with routine supportive care. The findings from the studies now include a second larger initially randomized phase 2 study that looked at 2 doses. And again, what we've seen is potentially the application of a drug with a new mechanism of action, a new target, which will serve an unmet need population in large cell lymphoma, where despite even advances like CAR T-cell therapy, bispecific antibodies, there's still a lot of patients we aren't curing that need new options. The goal with the story of a drug like Selinexor, though, in large cell lymphoma is that it's still not finished. It's likely going to have a place more as a combination therapy, and so the next couple of years we'll hopefully see the right combinations, as well as some studies that speak a little bit more to the mechanism of the drug and predictive biomarkers that will help select the right patient population.